and in the years ahead. The Power of Knowing is a free webinar series created by AuthoriCare Collective, a nonprofit organization that empowers people to be active participants in their care journey, enabling them to live on their own terms through personalized support for mind, body, and spirit. To get us started, please welcome our moderator, Risa Hanow. Risa serves as clinical and community educator at AuthoriCare Collective and is also a member of the Cone Health Ethics Committee. She is a licensed clinical social worker. Risa, I will turn it over to you.
Thank you. It is my pleasure to introduce our two panelists for today. First, Heather Ford. Heather is a physical therapist who graduated from the University of Kentucky with a Master's of Science in Physical Therapy. She has dedicated her career to adult neurology and geriatrics, working extensively in patient care, home health management, and as a geriatric physical therapy clinical specialist. Heather also is a certified dementia care practitioner, bringing advanced expertise and compassionate care to the older adult population. Welcome, Heather.
You.
And Dr. Christina Rama. Dr. Rama started her journey in healthcare as an oncology registered nurse, where she developed a profound understanding of patient needs and the challenges faced by those battling serious illnesses. Her commitment to making a broader impact on healthcare led Dr. Rama to pursue a medical degree at Wake Forest University. Beyond her professional responsibilities as the Chief Medical Officer at AuthoriCare Collective, Dr. Rama is a fervent advocate for mental health issues in her community. Welcome.
Thank you, Risa.
We want to get to know a little bit about who is joining us today. We have a large group already gathered, and we have two polling questions that are going to come up on our Zoom screen. And the two questions are multiple choice, and our polls are anonymous. So please feel comfortable responding. Let's see if we can get those polling questions pulled up. So our first one is, who is here today? Select all that apply to you. We know so many of us have many different roles in the life that we live. And then our second question is, what are greatest concerns that you have for yourself and maybe on behalf of another? Things like falling, having to move, not being able to handle household tasks. There are many, and I appreciate we're having lots of people respond. So as we look at who is joining us, we have a good distribution. We have people identifying as patients, family members, a lot of advocates, good number of healthcare professionals, and also spiritual guides, volunteers, and then our concerns. So looking at that, seeing a lot of concern around falling, whether I have to move from where I call home, concerns around not being able to drive any longer, managing personal care, not knowing how to get information that I need. So these are all things that we're going to spend time discussing. So thank you. We're still getting answers coming in, but clearly we are zeroing in on things that have concern for many of us. So thank you for participating in the poll. And I want to encourage everyone during our conversation, you can make use of the Q&A box, submit a question, and we will do our best to answer it during the time that we're together. So I think, Dr. Rama, when I look at our title of our program, it is Whole Person Wellness. And for those of us who might not be familiar, because I think about medical care and a particular diagnosis or a body part, um, get us started by telling us what exactly does that mean when we say whole person care?
That's a great question, Lisa. And, like you, when I think of, well, what does it mean to be healthy? My mind automatically goes to, well, do I have any chronic disease burden? And really, health encompasses so much more than just your physical personhood. That's a big part of it, but it's not the only piece of the puzzle, right? So when we think about whole person care, we think about spiritual health, we think about physical health, we think about psychological health, mental health, we think about relationships that keep us grounded and healthy in other ways, support systems, financial health. All of these things bear an impact on our overall well-being and happiness. And we can see people with very high burdens of chronic disease, and yet they remain healthy because these other things are in balance. And so when we think about health, it's important to consider all of these things that contribute to well-being and connection to those of us who have family or community members and friends that support us.
That's great. So it's really that broad view. And then Heather, if I look at the other part of the title, it says staying strong and independent. And as a physical therapist, I'm going to ask you, while I know there's no one answer for all of us, what are some things when I think again about that broad being healthy that we can think about as we age and as we help those in our life to try to keep ourselves as strong and independent?
Yes. Basically, if we got to think about what does it take to remain independent and live in the community, if that's what your desire is. Some certain things have kind of been established as kind of milestones that you have to be able to do to be independent in the community. One of those is to be able to walk at a speed where you can cross the street at a crosswalk where there's a light and make it to the other side before the light changes. And that speed is 1.2 meters per second. There's been extensive research on this that once you drop below 1 meter per second, your risk for falls goes up. And if you slow down even more, your risk for falls and injury goes up. So we, as physical therapists, will evaluate and watch that. The other thing is be able to walk a minimum of 1,000 feet. You need to be able to walk from your home to your mailbox or from the car into the grocery store and be able to do that more than once without being fatigued. Also being able to carry a package of about 6 pounds. That's the average weight of a grocery bag. So you need to be able to walk and have the balance and the strength to carry, a lightweight item. And you need to be able to have the flexibility and the strength to be able to change positions pretty easily, going from lying to sitting, sitting to standing, being able to turn your head to scan your environment, react to things in your environment, twist, bend, push, pull, all of those things are important. And we got to be able to navigate different types of terrain. So, not just your home, but being able to do a sidewalk that might be uneven, grass, gravel, wood, all of those different things we want to be able to. In order to stay independent and safe in your home, you need to think about all of those different things. And are you able to do those? And if not, how can you change what you're doing to be able to do that?
Okay, so that gives us a place to be able to function in our environment. And we'll talk more about if we think we have some concerns or how we might protect our environment. But Dr. Rama, I want to think also not just about how we move in our space, but what other things do we have control over when we think about our health? I'm thinking about, in addition to what Heather shared, things around nutrition and things around sleep. And there are things out of our control, but today we're focusing on what is in our control.
Right. Well, to piggyback off of what Heather was saying about mobility, a big risk to an aging population is the risk of falls. And falls, when you're aging, your bones can be a little more brittle. You can suffer from an injury at an older age that normally would not result in an injury at a younger age. And so prevention of falls is a big one in terms of aging well and not experiencing unwanted effects from something that could be preventable. So really centering your environment to help prevent falls. I always joke with my patients, do you have little dogs or kitty cats that are getting in the way? Because those are big fall risks. But things that also can increase the risk of falls are certain medications. When people tell me I'm not sleeping well, so I take Tylenol PM, I cringe a little inside because the PM that's in the Tylenol that makes people sleepy can increase the risk of falls and confusion and other things that may not be wanted. So making the home relatively fall-proof, looking at medications that might be contributing to the risk of falls, keeping up with vision and hearing checks. So poor visual acuity and poor hearing can contribute to falls. Looking at, well, what kind of footwear are you wearing? Those fuzzy slippers might be comfortable, but if they don't have backs on them, they might be prone to catching on things. And if they don't have good grips or, high heels, floppy sandals, those sorts of things can contribute to falls. And then you want to know, okay, if I were to suffer a fall, are my bones in decent shape? So am I taking a calcium and a vitamin D supplement to keep my bones healthy? Have I kept up with my DEXA screen, which is recommended for females over the age of 65 and males with certain risks for thin and brittle bones after the age of 70, or anyone really who's at risk because of their medical history should be up on those screening tests that can keep folks healthy and head off problems before they become acute and in need of more intensive treatments. As you mentioned, Lisa, nutrition and hydration are extremely important. You want to stay hydrated. You want to have adequate protein in your diet to maintain your muscles. And you want to engage in physical activity in as much as you can. And weight-bearing exercise is always a good way to keep not just your muscles healthy, but to strengthen your bones. Other than that, I think, maintaining good social connections, being active in the community with faith groups or whatever it is that you do to keep connected to friends and family also is important. And then sleep hygiene is another big one.
Yeah, we had a question that somebody sent about sleep and asking about whether a sleep pattern of sleeping for a period of time, maybe being up for an hour or two in the middle of the night, and then going back for another stretch of sleep, whether that's concerning. And maybe the question is, what is normal sleep, if such a thing exists? And why is sleep so important, and how does it change? Because it does change, I think, as we get older.
It does, and certainly I'm starting to experience this now. So as you age, normally what happens with your sleep patterns is you are spending less time in those deep REM type sleep patterns, more in the lighter sleep patterns. You tend to, as you get older, go to bed earlier and wake up more frequently. And you tend to suffer from problems that interrupt your sleep. So for females, this can be anything from frequently having to get up to use the bathroom. Also in males with enlarged prostates, you may have hot flashes, you may have chronic pain that, osteoarthritis, so that if you get into a certain position, you wake up with an ache or a pain. And so you have to navigate these things to help promote better sleeping patterns. In general, people require about 7 to 8 hours of sleep a night. And so sometimes people have unrealistic expectations that, when they were younger, they needed 10 hours of sleep. Well, as you get older, you don't need quite as much. But sleep is still important to restore your body and to maintain health. So it is important to pay attention to sleep patterns and what it is that might be keeping you awake. So how you treat a sleep disturbance that is the result of a flare of osteoarthritis or frequent urination is much different than treating someone who truly has an insomniac condition where you actually have a disorder of the sleep cycle itself. So teasing out what is causing the problem and having realistic expectations that you may only need 7 hours of sleep. So if you're going to bed at 9 and expecting to sleep till 7 o'clock the next day, and that's 10 hours, or 10, 11 hours, you don't need that much sleep potentially. And so if you have this expectation, I'm going to sleep the whole night through for 11, 10 hours, and you only need 7, there is going to be a lot of awakening, but it doesn't necessarily mean that there's a problem.
I like that. And I think also when you say tease out what's keeping us awake, is it the physical? Is it I often say my brain goes, when I wake up, it's, my brain wakes up and I start thinking about. So we know
Right.
that so many different things.
Anxiety is a big one. If you're ruminating about, bills or, a family member who may be in crisis or other things, that's going to interfere with sleep. But you don't have a sleep problem, you have an anxiety.
Right, right. And I think it is thinking about the why. And Heather, so when we get up, talk to us some about that fall prevention, the not having the fuzzy slippers, but the slippers with a grippy bottom, or moving slow, just things that we can think about, keep front of mind so that we do stay upright when we want to be upright.
When I go into a home and evaluate the patient's fall risk, or we go through and we look at everything in the house and try to kind of problem solve certain areas. First is definitely proper footwear. You don't want to have some either socks on or something with a slippery bottom that could cause you to slip. When people do get up, I always tell them, take a minute before you just get up and go. Make sure that you're not dizzy or lightheaded, that are ready to get up and move on. At night, I recommend people having a night light in the bathroom so that their path is illuminated, or in the hallways if they get up in the middle of the night and go to the kitchen to get a drink of water. Make sure they at least have something to light the hallways, so that they can see where they're walking. And make sure that there's a good, clear pathway for them to walk from room to room. Removing any clutter that might be on the floor. As Dr. Rama said, with pets, sometimes pets leave their toys. We want to make sure that those get picked up at the end of the day, or that, you're scanning the environment for those before you get up and decide you're going from the living room to the kitchen. So those are definitely the big ones. Footwear seems to be the biggest challenge. People like the nice, fuzzy, cozy slippers, or just prefer socks. So I sometimes have to talk people into getting a nice tennis shoe to wear all day in the home. That's a great way to prevent falls, by having something good and supportive on your foot.
Great. And I also think, Heather, about if I have concerns, you mentioned a physical therapist when you go and do a home fall assessment. How is it that we get a physical therapist to come to our house? Why do we get a physical therapist to come to our house?
Typically, someone like Dr. Rama would write the order for us to come out and evaluate someone because they've got complaints of pain, or they've had a fall, or they feel weak. They don't feel like they can accomplish the things that they normally should be able to accomplish during the day. For home health, the person that I'm going to see is really required to be homebound. They have to, it has to be a taxing effort for them to get out of the home and get to, say, an outpatient clinic. So that is a requirement for home physical therapy. So sometimes I see someone a little bit further down in the process versus in the preventative stage as as a provider. But that is always a part of our evaluation, which is nice for me to see what their environment is. What are the challenges? What are the obstacles that they face on a day-to-day basis? And then, between myself and an occupational therapist, we make recommendations to make each part of the home as safe as possible. From the kitchen to the bathroom to the bedroom, being able to get in and out of their home, we can suggest assistive devices or modifications that you can make easily to your home to make it safe.
I'm thinking about, being able to advocate either for myself as a person receiving care or if I'm going with someone. So if I was seeing physical therapy in an outpatient setting, how would I I want to describe what my bathroom is like, or what should we be telling that physical therapist if I'm going for physical therapy about my knee or my shoulder so that you can help me in the best way when I do return back home?
Typically, the bathroom is the most challenging environment in the home. Many homes, especially older homes, have smaller doorways that make it difficult for a walker to fit through there if you're using a walker. Um, that therapist sometimes can fix the problem by moving the walker wheels to the inside of the walker versus the outside, which saves about 2 inches of room. I find myself doing that at almost every visit when I see someone new. That way you don't have to sidestep into the bathroom. You can take that walker all the way in. If you're having trouble getting on and off the commode, putting either a raised toilet seat in place, or you can use a bedside commode without the bucket over top of the toilet and make that as tall as you need it. So if you have arthritis in your knees and it's difficult to get off from the low surface, you can raise that up and you've got armrests to push off of. Grab bars are a great addition, and that your therapist can really kind of tell you where those are could be beneficial. Using a shower seat in the shower, having a handheld shower, kind of explaining to your therapist, I have a tub shower versus a walk-in shower. That gives us an idea of what type of equipment might be best there. Um, and then kind of going through what other things are challenging for you. In the kitchen, you have a hard time reaching things in your cabinets and you're stepping up onto a step stool, which could be a risk for falls for you. How to rearrange, we would give you some tips on rearranging your kitchen so that you can get those items that you use on a regular basis. And then we talk through your bedroom as well. Is your bed high? Is it low? Do you need to add a little bed rail? What types of things are challenging for you in each different part of your home? Or is it getting in and out of your home? Is it the steps? Do you have a handrail? Do you not have a handrail? Things like that, really just describing where your challenges are. And your therapist will probably ask the right questions to know exactly what your setup is, because we're very familiar with that, especially with older adults, because fall prevention is probably the biggest thing that we work on.
Right. That's wonderful. I mean, that gives a good overview, and also all of those things contribute to being independent and being able to enjoy the social activities and remaining in the space where we want to be and thriving. And I think thriving, Dr. Rama, is a word that we want to live well, and part of that is thriving. And it can be challenging as we age with different concerns. And somebody posted a question about concerns for short-term memory. And I know we're going to have our next webinar about brain health, but when I have a concern, whether it's my short-term memory, my knees are bothering me, how do we approach our providers in terms of I don't know, feeling empowered or feeling like I have the right to ask questions. It can be intimidating sometimes.
Well, I would encourage people to bring a list of questions with them, because what happens inevitably is you feel rushed when, people come in and, you've got the medical assistant coming in, taking your medication history and doing your vital signs. And then sometimes physicians, because they are rushed, will give that impression or not hide it well when they're in the room with you. And if you are mentally prepared by having a list of questions, then that sort of anchors you in the moment. And, having, again, some expectations, the physician may not be able to get through a list of 20 in the time that you're allotted, but certainly should be able to address your top 2 or 3 biggest concerns. And then, you can schedule a follow-up visit at a shorter interval if you haven't gotten all of your questions answered in that initial encounter. So I would definitely, bring a list of questions, write down the answers, because it's also common that when you visit the doctor, unless you're bringing an advocate or someone who can sort of actively listen along with you, sometimes you don't recall all the information that was given to you in that session. So bringing a list of questions and writing down some answers helps empower you, number one, to ensure that you're getting your needs met, but also that you're taking away good information from the time you have with your provider.
Right. When I think about, I go to the grocery store with a list. So, it makes sense that we would have that. And I know that the healthcare environment can be a challenging one for many of us for lots of reasons. And one is, I think, about medication. You mentioned earlier, if I'm taking Tylenol PM, well, I can just go and buy that, take it. Maybe you as my doctor know I'm taking it. Maybe I don't mention it. And you prescribe something else for sleep. Talk to us about medication. It seems like more medicine gets added and added and added, and oftentimes it doesn't get taken away, or we don't understand the full impact.
That is a huge problem, Lisa. And I think physicians and providers are really good about tacking things on, and they're not quite as good at deprescribing or removing things. And like everything else, as we age, our bodies metabolize medications differently. And so it's not unusual for dosages to need to be adjusted to reflect slower metabolisms. It's not unusual for medications to begin to compete with one another for effects, or for medications to induce side effects that then get addressed with more medications. And sometimes the right answer is not adding more medications, but deprescribing the one that's the problem. But like everything else, when clinicians are busy, they sometimes go to press the easy button, which is, well, patients complaining of restless legs, let me go ahead and give them something for that, and not necessarily to scrutinize their medication list to see, oh, this patient's on 2 or 3 medicines that might contribute to restless legs. Let's get rid of one of those. And so, I think having a healthy index of concern when you're being prescribed something, and advocating to say, is there a non-medication solution to the problem I'm bringing to bear? Or can you review my list of medications to make sure that I'm still, the list is still good for someone of my age and my current medical status? So asking for your providers to do that extra level of scrutiny, I think, is an important way to advocate for yourself. And then to always, bring an accurate list of what you're actually taking to your appointment, including anything that's over the counter or supplements that you're taking, because a lot of supplements do have ingredients in them that can do things like raise blood pressure or contribute to other medical problems. And if your doctor or clinician is unaware that you're taking those things, it could impact some of the decisions they make around recommendations.
And along with that, I think about taking the medicine that is prescribed correctly. And that can be overwhelming if we have a number of medications different times a day. And tell us about, I mean, I know there are pill packs or there are different dispensers. Would you advise making use of something like that to try to, I'm thinking the person asked about short-term memory, but even without memory issues, it can be daunting.
Yeah, 100%. If you're on, complicated medication regimens and you're taking pills multiple times a day at different times, having a pill organizer not only helps keep you on track, but then if you miss a dose, you can tell exactly which dose was missed. There are many, many pharmacies out there that prepackage medications so that you know that they come with the date and the time you're supposed to take them stamped on it. The only downside I see to that is if there's a medication adjustment, then what do you do with, this whole pack of pills? So if you can get away with a pill organizer that you organize yourself, that would be my best recommendation, though these pharmacy derived pill packs are really good in folks that really need someone actively packaging the pills with the date and the time. And they have all kinds out there. There's a one that I just bought on Amazon where you put all of your pills in a container, and it's sort of this round thing, and then you just click around. And so if you run out of pills frequently, you can put the whole month's worth in there, and then you can label the different sections. So that's kind of handy. But anything that helps you stay on track and helps you remember to take your medications is a good idea.
And Heather, I'm thinking about, in order to do that, you have to be able to open the pill bottle, you have to see, you have to be able to get up to get something to drink. Tell us maybe one question, the difference between occupational therapy and physical therapy.
Physical therapy, I think of more your general mobility, your ability to get in and out of the bed, your ability to walk from one place to another, your overall strength, balance, knowing where your body is in space. Those are kind of the big levels. We work on stair climbing and long distance walking and things like that, where the occupational therapist will work more on things like fine motor skills, like opening a pill bottle or a package, opening milk cartons or things like that. They also work on ability to get yourself dressed in the morning, being able to shower safely, get on and off the toilet. So occupational therapy is sort of it confuses people because they say, I don't work anymore. And it's not about your work, it's about the work of life. You have to do all of these things in order to live. You take a shower, you have to make your meals, you have to, organize your day. And they do some of that as well, even working on cognition. So
Great. And somebody had asked a question about finding like a over the bed or over a bedside commode that had wider stance to fit a person. There is specialty equipment. How do we go about getting equipment and knowing it's the right thing and it fits and it's
if you have a therapist working with you, we usually order it and we send in measurements so that the bedside commode fits you, fits your height, weight, your hip width. And same with a wheelchair and a walker. We want to make sure it supports your weight. There's different sizes. We have some people that are very tiny and need something very small, and we have very tall people, all different sizes. So we typically will order it. If you're getting it on your own and you go to a medical supply store in the area, that's one of the things that you should tell them when you're purchasing the item. I am this tall, this is my weight. They may take a measurement of your hips and they'll tell you which one is the best size for you. If you are ordering off of something like Amazon, which I have a lot of people do, if you read down on the description of the item, it should tell you the width. It fits up to 22 inches wide. It would hold up to 350 pounds. And there's different sizes that goes all the way up to 1,000 pounds. So you just have to look if you're doing this on your own. The other challenge is if you're doing it on your own and you're getting somewhere like Amazon is usually comes in a box and you have to put it together. So having someone help you with that or a therapist working with you is helpful, making sure that it's set up correctly and it's the right height from the floor and all of those things. So that's where I would recommend either having the provider at a local store or a therapist work with you and setting that equipment up properly.
Great. I think having the equipment is wonderful, but if we don't know how to use it or it creates more of a risk, that can, tripping over the walker, because I'm not using the walker, but I'm gonna so talk to us, Heather, a little bit about, sometimes I think we say, oh, well, we're getting older, so the fact that I can't get up and down easily, that's to be expected, or I can't walk as far without getting short of breath. I imagine there are things that we can expect to be able to do, and if we can't, then maybe we could raise that with our provider. Or what are some things, some general, I don't know, guidelines that I want to be able to fill in the blank?
So there are recommendations for general exercise throughout life. For geriatric or older adults older than 65, the CDC recommends 150 minutes of moderate to vigorous exercise a week. So that might be just walking, something like that. But if you think about it, that's 30 minutes 5 times a week that you should be doing something to, that's a little bit challenging for you physically. You should be able to, even in your 90s, stand up from a chair without requiring the use of your arms to do so. That's still normal. And there's evidence out there that even people that are in their 10th decade in, age 100 can make gains in strength, balance, and endurance just by being more active. So, we always recommend that. Resistance training, so either lifting a weight or using an exercise band is, as Dr. Rama said, helpful for our bones. And it's important to do that. And it has to be challenging enough that you're going to build muscle. You don't want to be too easy, which is typically what happens. People take it too easy, and sometimes we're too easy on them. That's something that's been out there is we're not challenging our seniors as much as we should with exercise to really make those gains and get those differences. The other thing that's important is trying to maintain your general flexibility so that you can move safely and pain-free. So
I'm going to turn to you, Dr. Rama, and think about pain-free. So what are some of the things, as we age, there are changes. You said we can expect some changes in our sleep. Maybe we're going to have changes in the way medication impacts us. What are some of the normal things? And then thinking about when is it that I should really be seeking, input from my doctor or my provider?
That's a great question. So, degenerative joint disease, arthritis affects us all in our 5th, 6th decades of life. This is normal wear and tear on the joints. And so you can expect that that common sites of arthritis, hips, knees, hands, those sorts of things, sometimes the back will be a little stiff in the morning and might get less stiff as the day goes on. If the pain is to the point where it's beginning to interfere with your ability to do the things you normally do, that's when it's time to have a conversation with the doctor. You may benefit from anti-inflammatory medications. and other things that can be done to help preserve joint function, and minimize the risk that the pain will keep you from doing the things that you need to do during the course of your day. The other thing is pain can put you at a risk for falls too, right? Because you're gonna preferentially favor one side over the other, and it might lead to gait instability or balance problems that puts you at risk for falls. So if you're noticing that pain is causing you to walk differently, or protect a joint, then it probably is time to see a doctor about that.
And I'm thinking about the cycles that can be set up. So if I'm having pain and I can't move as well, then I might not participate in my social activities. And that might impact, not only my enjoyment of life, but maybe my diet, because I eat better when I'm with other people and now I'm not going out. Talk to us about some of the broad view of health and how interconnected our minds and our bodies and our spirit all are.
Well, I think you highlighted it perfectly well, right? I'm having pain, and then that pain is preventing me from, going out and doing the activities that normally bring me enjoyment. Now I might suffer from depression, or I might be anxious because I know that a certain activity might trigger pain. And so that anxiety might, in and of itself, prevent me from even risking an activity if I feel like it might cause pain. And then that social isolation can trigger mental health problems. The other thing is I might start to self-treat with over-the-counter medications or even illicit substances or alcohol. Often I'll hear patients who tell me they drink because they have pain, or they use other substances because they have pain. And, we have entered a phase of medicine where opioids and the opioid crisis has really discouraged clinicians from using that particular class of drug to treat severe chronic pain. But there are other treatment options out there that are worth exploring with a healthcare professional or a specialist, if that's, if you have severe sciatica or nerve type pains. There are other really good treatment options out there, including things like TENS units, where they implant thing that stimulates the nerves or helps block pain signals. So there's all sorts of new and cutting edge therapies that are out there that could help folks with severe chronic pain.
And talk a little bit about nutrition. I mean, our input of, what we put into our bodies. I know some people are very attentive to their diet. Other people don't pay attention to it. Where's our middle ground in terms of, as we're getting older and wanting to be healthy, what should we be focusing on aside from being hydrated, which means we have to get up and go to the bathroom more? But what should we be thinking about?
You have to think of diet as being like a drug. And so what you eat has an impact on your body's performance. And there are certain types of fats that are pro-inflammatory and promote inflammation and worsening pain. And there are certain fats that are anti-inflammatory and help reduce inflammation and pain. So, a healthy diet is going to be one that has lots of fresh fruits and vegetables and healthy sources of fats that you would get from lean protein sources, fish oils, nuts, flax seeds, those sorts of things. Red meats are pro-inflammatory. Fish oils and nuts and certain things like flax are anti-inflammatory. So definitely diet does play a role in healthy aging and prevention of inflammation. And inflammation is not just about my joints swelling up, right? Inflammation can also be in the blood vessels that can trigger heart attacks and strokes. And so really concentrating on a healthy diet can not just help prevent problems from happening, but can help ease problems that are already there, such as chronic inflammation problems.
And is it acceptable for me as a patient to ask my physician or provider if I can see a dietitian or to get a referral to a physical therapist? I mean, in terms of what my right is or what I should feel comfortable doing, is that, I don't know, does that put you off when I ask for those things, or we should be doing that, or bring somebody who could help us with that?
Whenever I see someone who's engaged to that level, it makes me happy. So don't, and I don't think I'm unique, right? I think doctors really, more often than not, get discouraged when the patient comes in and wants a pill to fix everything, right? Somebody's wanting physical therapy and diet, then I know they're invested in a good health outcome and they're willing to make some hard choices, because let's face it, when you go to a dietitian, they're not going to tell you cake's okay and, eat all the sugar you want. They're going to put you on, give you some education around eating healthier, which generally, doesn't always equate to food choices we might want to make, but that are good for us. And the same thing with physical therapy. If somebody's committed to going to a physical therapist 3 times a week and learning how to do strength training and other exercises, that to me is a highly motivated patient that I am more than happy to help and get those things lined up. So it should not be off-putting at all to any clinician. And if it is, you need to find a different clinic.
Right. So really, I mean, the passive patient, I think about the model of, my parents' era where the patient just said, yes, doctor. We have moved to a different place happily where we can advocate and bring things forward and expect that they be respected.
Absolutely.
And so, Heather, before I ask the next question, I want to just, there's something in the chat about asking around financial fraud and scam, and know that that is going to be part 3 of our webinar series. So we will be talking about that, just not today, but an important topic. But Heather, I was thinking about, not everybody is going to get that order for physical therapy or have the diagnosis or the ability to have that prescription and insurance cover it. What are some options in terms of, is going to Silver Sneakers or some other organized exercise program? How do I find something that's right for me?
It is a challenge. Typically, the YMCA has a lot of programs for older adults, and they do a pretty good job, I've found, in providing scholarships if the financial piece is a challenge for you. And they have things for all different ages. And most of the time, they do have a pool as well. So if you have a lot of arthritis and, the land exercises really cause you some pain, they have exercise programs that you can do in the water. There are also different websites if you are someone that is computer savvy. The CDC has a whole program on for geriatrics called STEADY. It's called Stopping, it stands for Stopping Elderly Accidents and Injuries, basically. And on there, they have some recommendations for things like an Otago program, which is a balance and fall prevention program. The Silver Sneakers, there's one called SAIL that's like Stay Active and Independent. And they can, on that website, you can find where one is locally to you. They also have information about this is what you should be able to do, and here's some ways to do it. The National Institute of Health has an aging portal that talks about having a safe home, and it talks about some home safety recommendations. So there is a lot out there on the computer if you are looking and you want to make sure you're looking at a reputable site, like something like the National Institute of Health or the CDC. somewhere that you know has a good reputation, and you can really find things for recommendations for exercises you can do at home, for things to stimulate your brain and keep your brain active. There is a lot out there if you are able to access that or have someone to help you access that. But most of the local gyms will have a seniors program. Um, that you can do a sit and be fit, or like the silver sneakers or something like that. So there's a lot out there, and I find that people really enjoy that because it does give them that socialization as well, and see, other people that are in the same situation or same boat, or motivate them to be as healthy as someone else that's in their group. So those are always really great options.
Right. And we have a number of resources that we're going to be sending out with an email tomorrow. So thank you for mentioning some of those. And Dr. Rama, I wanted to talk a little bit about, we all want to stay as healthy as we can for as long as we can. And we also know as we age, there's an increased likelihood of having health conditions. And I'm thinking about sort of that risk benefit. Do I undergo this testing, and what if something is found? I'm, of a certain age. Do I really need to keep going for my colonoscopy? How do we figure out this risk benefit of what's right or best?
Lisa, that is a great question. So the U.S. Preventative Task Force does publish guidelines that guide clinicians and primary care providers about what screening tests are recommended and during what age ranges. And there are certain screening tests that only would apply if you have certain risks. So for example, male smokers who have ever smoked are recommended to have a one-time screening abdominal ultrasound to rule out aortic aneurysm. So that's a very specific situation. Colon cancer screening, like you alluded to, breast cancer screening, cervical cancer screening, all published guidelines about what ages it makes sense to do that. And to your point, right, it doesn't make sense for everybody to do these things, because if you do not want to act on a positive result, you probably shouldn't have the test. The purpose of the test is to find something when it's treatable. And if the treatment entails surgery, but you're not a surgical candidate, and or chemotherapy, and you're in a health situation where you wouldn't be able to tolerate chemo, or that if those things don't align with your care goals, you probably shouldn't bother getting the test, right? Because it's going to increase anxiety. It might find things that you didn't go looking for. And if you have no intention of doing anything about it, why go looking? The other thing is certain medications are designed with a certain life expectancy in mind. So if your life expectancy, for example, is less than 3 or 4 years, you might not need a statin any longer. And so really looking at and having a goals of care conversation with your provider to say, look, this is what matters to me. These are the health concerns that are most important. I don't want to take a handful of pills to prevent something 20 years down the road if my life expectancy is 3 or 4 years. And so knowing and having those conversations and being comfortable bringing it up, because clinicians and primary care doctors may not always do this without prompting. So to be an advocate for yourself, in addition to bringing that paper with, these are the questions or the things I have that I want to address, write down, I want to discuss my goals of care with my primary care doctor or provider, so that they know what my wishes are, how aggressive I would want to be in the screening tests and the vaccines, the other things that we do preventatively to keep us healthy versus, hey, it probably doesn't make as much sense for me to do some of these things because of, my goals of care.
Wonderful. And so as a final question, Heather, I just think about if we have a physical therapist or occupational therapist, you're going to be communicating back with the doctor, right? You're part of that coordinating of care. That strikes me as something that's so important.
Yep, definitely with both outpatient therapy and home health therapy, the primary care provider is part of the care team and they sign off on our plan of care, so that they're aware of what, our established goals with the patient were during our initial assessment. If they don't agree with those, then they can definitely step in and let us know. Um, so 100% the primary care provider is part of the team when we provide therapy in any setting.
Wonderful. Well, this has been a great conversation. I appreciate it. Thank you both so much, Heather and Dr. Rama, not only for this conversation, but really what you do every day. It is beyond meaningful and helpful for so many. So thank you. And thank you to our participants. We'll be sending out tomorrow an email that will have access to the recording, so you can view this again, share it with others. It will also have resources that were mentioned and some additional ones. And then we want you to look forward to our next 2 webinars that are a part of this series in a month. On March 19th, that's also a Thursday at noon, we're going to be talking about brain health and really talking about that, memory loss and when is it that we should be concerned and what can we do to keep our brains as healthy as possible. And so Dr. Bethany Wanglin will be joining us for that conversation. And then as we move into April, the third part of our series is going to be really looking at our financial peace of mind and health. And somebody mentioned about scams. We have somebody from AARP, and she is particularly going to be talking to us about that, scams and fraud alerts and things of that sort. And then also an elder care attorney who's going to be helping us think about what do we need to do to have our financial house in order, some advanced care planning documents and other things that we can do today, but also to ensure our future. So thank you for participating today and look forward to everyone joining us for the next 2 webinars in our series. And before we end, I wanted to share a quote that I found from Ringo Starr. And he said, "People look at me as a beetle, but my friends look at me as a whole person." And we all want to be seen as a whole person and strive for the best health each day that we can have. So thank you for joining us, and I hope that everyone has a good rest of the day. Thank you.
Thanks for having me.
Thanks for having me, and thanks everybody.